Well, after what has now been 6 weeks on the picket lines, the Oregon Nurses Association has reached a tentative agreement with Providence for a second time. Our Celine Stevens has been following this story for weeks now. And Celine, how are the nurses feeling about this new potential agreement?
John, I heard some in favor, but also a lot of people were still undecided. They say, well, they did get one of the big things they were fighting for. They did have to give up some of their other points. Now all that's left to do is wait as nurses cast their vote.
I haven't decided how I'm going to vote on this contract yet.
I'm not really sure. I'm still kind of thinking that out.
Nurses, a part of the Oregon Nurses Association at all 8 hospitals, are now voting on another tentative agreement with Providence.
Everyone's going to have to look at it and see how it measures up. The things we won, the things we didn't win, and see if they're willing to say yes.
This comes after the majority of nurses voted down the last tentative agreement just a couple of weeks ago.
It's better than our first TA, for sure, but still not what we really hoped for.
Here's what it entails.
The one thing that we did get is some more language regarding safe staffing, which was one of our biggest asks, and that's the one thing we feel better about.
According to the ONA, patient acuity will now factor into staffing plans.
When we develop our staffing plans, we have to define the number of nurses that are required, and we have to consider how sick the patients are, how intense the level of nursing care.
The ONA says they also got major wage increases as well as retro pay, which was a big talking point for many nurses. However, that has limits.
They're not paying 100% of it, though. They're only paying the nurses 75% of the money that's due to them for the work they already did.
Additionally, it's only for nurses at bargaining units whose contracts expired before December of last year. It will also happen in phases, meaning they won't receive their last 25% of pay until October. In a statement, Chief Executive of Providence, Oregon, Jennifer Burrows, said that Providence is hopeful that ONA-represented nurses will ratify the tentative agreements that pave a solid path forward for us all. Now, nurses have 48 hours to decide how they will vote to potentially end the month-and-a-half-long strike.
The cost of staying out here longer for our nurses versus what we could win if we stayed in it another 2 weeks or a month is something I'm considering.
Nurses also told me they did have to give up on getting more paid time off as well as contract alignment with other hospitals. The vote started at 4 p.m. today and will last until 4 p.m. on Monday. If ratified, nurses will return to work Thursday. John?
All right, our Celine Stevens tonight. Thank you, Celine.